The patient will have symptoms and go to their GP normally, and sometimes they'll self-refer to physiotherapy. Those are the two main ways that they come into the clinic. When we see them in the clinic, we'll take their history, examine them, and if they have hip or knee arthritis, they've exhausted non-operative measures and they're ready for a joint replacement, then we'll have a chat with them about the pros and cons of joint replacement surgery. Some patients are suitable then for day case surgery. It tends to be people who don't have much in the way of medical problems. They'll have normally some good home support. Their mobility is pretty good to begin with. And yeah, so if they're suitable for day case surgery, and they have to be quite motivated for it themselves, that's really the main factor. We would never try to convince someone that it's the right thing to do for them. It's really their choice. So they have to be quite motivated to want to go home on the same day.
I have osteoarthritis in my inner knee, and I also have a bucket handle tear in my meniscus, which means I can't straighten my leg properly, which affects my walking. I used to walk for 2 hours a day. I used to go on the back of my husband's motorbike. I used to horse ride, I used to play tennis, and I've just not been able to do any of that for the last 2-3 years. And the walking, I was managing to do 20 minutes a day, and that's just shrunk. I can only do 5 minutes now. So I'm really looking forward to just getting out for a walk with the dogs would be nice.
So joint school is basically for anyone who's getting a joint replacement to come in and learn a little bit about who's going to be seeing them on the ward, what every profession expects for them to do on the ward and what to kind of bring, what to kind of set up at home so they're a bit more prepared to come in, and then just kind of chats through how the day will run for every kind of person and kind of what might happen, what might not happen, what to expect. So it does make that process a little bit easier. So when we come and we say, oh, we're going to try these exercises, they go, yeah, I've already tried them, or, oh yeah, I know what to do because I've been doing this at home already, or yeah, I remember you telling me this.
Our role is to prepare the person before they go into hospital and make sure they understand what kind of challenges they're going to face when they go home. So one of the things we do is before they would come into joint school, we would contact them and fill out an initial interview. So this would let us understand how they're managing at home at present, meal preparation, self-care, any commitments they have, any conditions they already have, and it gives us a better idea of what kind of support they might need. It also puts them at ease when they come to joint school, because we can run through the whole process, what's going to happen with them. So yeah, mainly it's about making them remain as independent as possible when they go home.
Normally, people are pretty mobile after the surgery. They're able, with the painkillers, support from the staff, the physiotherapy, they're able to get up and start walking on the same day. And if they're able to pass the tests from the physiotherapy, then they don't always actually benefit that much from being in the hospital overnight and that second day, because we're able to give them all of the medications they would otherwise take. We can give them for them to take at home. We give them exercises to do. They tend to get a phone call the following day just to make sure that everything's fine, that they've managed to get up and they're managing to do their exercises and they're not in too much pain. And then they get close follow-up from our wound surveillance team as well to make sure that there are no issues with the wound healing. So overall, it's quite a nice option for patients who are quite driven to try and get home on the same day of surgery, which we didn't really do joint replacements as day case procedures even just a few years ago.
So we come in kind of post-op, we make sure that whatever they have had kind of anaesthetic-wise and block has kind of worn off, so make sure all their muscles are kind of working again. With your knees, we run through all the exercises first to make sure that all their muscles are working and that their joints nice and supported, and also kind of check their post-op notes. And then we kind of get them up, get them walking as close to their normal as we can. So whether that's with some crutches or some sticks or a Zimmer or whatever that is for them. And then we maybe have a look at them steps and things like that. So making sure they're safe, kind of getting up and down their stairs, getting in and out of their house, getting out and about, and then kind of discussing kind of how they will progress with their exercises, how they can progress with their walking, making sure that they're safe at kind of all these separate steps so that when they do go home, they've got all the tools that they need to be able to kind of either manage themselves or they've got that referral in place afterwards. So if they do have questions or do have issues, that we can chase them up and make sure they are managing fine.
I am excited. I want to get back to my life.